Everyone to this 211 information session. We are super excited to be co-hosting this exciting event. It's going to give you some information around 211 and what is it and how it works and why is it important. At United Way, both locally and across the movement, we fund 211 and we help to raise awareness around 211. It's important locally because it helps people navigate the social service system in a way that we haven't quite seen before. There are a lot of programs and services available for people, and it's important that we have information in how to get them attached to those services and programs. And the reason it's important to do that locally is because there's nuances that happen in social services that if it were managed more centrally, that information might not be available in the same way. So with that, I'm going to turn it over to Sarah Tanner. Sarah is the Community and Customer Services Manager with Northumberland County. And Northumberland County has been a big supporter of 211 and they fund through United Way as well as their own sort of initiative. So I'll pass it over to Sarah to speak to why the county supports 211. Sarah Tanner.
Thanks, Bobby. I've only got a few words to say, really, just mirroring some of the things that you've said. You know, the Northumberland County has a vision about bringing people together and creating those strong and vibrant communities, and 211 is one of the tools that we use in that work. Aligning with 211, you know, working to connect people across a range of different government services, health services, all of social services, really is key in the work that we do. We're very explicit here in the county, you know, that our strategic plan is about supporting those actions which do encourage and develop those strong and inclusive communities that we all want. And 211 is just one tool in our basket to be able to do that. We really enjoy working with United Way. We know United Way has those local connections, that it's really good at building those relationships. It knows what's going on in the community and can help us in our search for the information that we need and help us to develop new programs. And doing that with 211 is something which benefits everybody and helps us have the added value asset of a local and free service with free information. I think it's important that in social community and social services, as a department within the county, you know, we're working with people who have issues around housing, around homelessness. We're working with people who may be applying for social assistance, applying for other financial assistance. We're working with people who are concerned with youth and children and childcare, a whole range of issues looking at life stabilization. And it's really great that we have the 211 service that is something that people can use at a later date. They can use it there and then. They can share that information with their friends. And it is just that portal to finding the piece of information that they're looking for that, as I mentioned, will help in terms of life stabilization. So as a county, we're very happy to work with the United Way that help guide and manage some of this work locally. I've also met Pam on a few occasions and tried to develop some new and innovative projects, and it's great to work with an organisation that not only coordinates 211 for us, but is also able to think outside the box and help us find solutions to issues that we have locally. That's all I wanted to say, really. Thanks, Bobby.
Wonderful. Thank you, Sarah. And from there, I'm going to turn it over to Pamela Hillier. She's the Executive Director with Community Connection in 211 Central East Ontario, and she's going to give us all the information we would possibly want to know about 211. So without further ado, Pamela, please.
Great. Okay, I'll just start my sharing here and just trying to see where my share button went here. Oh, I lost it. Here we go. There. So can everyone see my screen?
Yes.
Yes, okay. That's great. Okay, so I'm just going to walk through a few slides and then we can have answer some questions at the end if that's works for everybody. But I really appreciate being here. I know this year we've been a lot more engaged with local communities across the region as everyone's extra challenge in serving our communities. So So for Community Connection, we're an information referral and assistance organization. We're a nonprofit corporation and a registered charity, and we're located in Collingwood. And we're one of 6 integrated contact centers in the 211 Ontario network, and hence our moniker 211 Central East Ontario. And we're one of over 20 organizations in the 211 Canada network, where United Way, Centraide Canada is doing a lot of really good work nationally. So just 3-digit dialing codes are approved by the CRTC to really help the public access special services. So we're all familiar with 911 and accessing emergency services, and 211 is that essential helpline for social services and community organizations, health and government programs. So our 211 service is expanding this year right across the country. We should be nationwide before the fiscal year end. And it's really meant to be that high level awareness, easy to remember number to access the various contact centers that are located in whatever community you're in. And you'll get the same or similar service whether you're in Northumberland, Manitoba, or British Columbia when you call 211. In Ontario, we have a provincial office, that's the Transfer Payment Agency, and we're funded provincially through the Ministry of Children, Community and Social Services, and they provide a coordination and oversight for our system. The map showing the 6 colors are the 6 regions of the 6 call centers that are integrated, and the green map is what is called Central East Ontario, and hence why I'm speaking to you from Northumberland County today. So the 6 call centers are integrated, and what that means is the calls flow across all 6. The phone system can program that way when some staff are down in one call center, your calls are still being answered and supported with any of the regions. In our specific catchment areas where we're responsible for the resources, the services that are provided in your community, and things like this, doing outreach and awareness. So we do a lot of work. I work with 8 United Ways across our region. So our core work is really 3 things. The first is inquiry services. So I think everybody can picture what a call center looks like and how that could function. The second is the community resources and those details on all your services that are provided. This year has been our most challenging, keeping up with those changes for sure. And then we track the needs and trends, why people are calling, and the gaps and unmet needs. And that's really where our data, the power of that data really helps inform your municipalities and your United Ways on the needs and trends. So from a call center perspective, we don't just give out phone numbers. So this little visual helps you kind of picture what the call looks like when it comes in. On the left, someone that, even if someone calls and they know they need utility assistance, we'll still do a bit of a needs assessment, because if they need utility help, they probably have other needs that they're not asking about because they haven't maybe thought about that, or they're able to cope, but there could be other supports for them. So our navigators do a quick needs assessment where it's appropriate. We'll provide information and assistance, which might look like a referral, or it might look like an intake or a warm transfer, depending on the organization we're connecting them to. We'll do advocacy and follow-up. So we may do a warm transfer and have a 3-way call for a caller that's a little intimidated or not very confident about following through. And then we document all the details about the call, not so much on the caller's identity, and we will continue across that continuum to make sure the caller knows what to do next. If they have multiple issues, that they can prioritize those. We'll make those referrals, those advocacy calls. Anyone with unmet needs or mental health, we offer a follow-up call. We can call you back next week, make sure you've connected to the program. And if the follow-up occurs or is accepted, then we'll make that outbound call in 3 to 5 days, depending on what the need was. On the resource side, we have a centralized data repository, and Terry Dudek is on the call today. So Terry's located in Northumberland County, and she helps us focus on the 4 info area, on the work in keeping up to date on the various programs and changes in your community. So when you suggest an update or receive an email, it's probably Terry that's prompted that. So I really appreciate Terry and her knowledge of your community contributing that to the resource database. Other the database is available on our 211ontario.ca as a search directory, and we do lots of things with the database. One of them is the Food Help in Northumberland County online directory, which I think we did that last year, the year before, Sarah, I don't remember. Just taking a subset of the database and be able to present it in a way that is useful to a community. The second one is showing a GIS map in Simcoe County. So the data goes through an API and is displayed on a mapping system. And in the bottom, we can pull out that data into an Excel file. So if you have a community group working on age-friendly strategies, we can actually give them an inventory of all those services for those that are older in the community, or food, or housing. So the data is really valuable to do kind of asset mapping or planning in a community. And then the needs and trends report. And I just pulled this one today, so it's kind of hard to read, but over on the right, you'll see, I just pulled Northumberland County. And this was updated at 5 a.m. today for the calendar year. And so we've had 705 contacts, which is a little down from last year, actually. And you can see the top need, mental health and health services are equal. And then the next was income, then housing, and then other government, specifically government programs. So we can see that really easy and in real time. This is a similar screenshot, again, updated this morning on the unmet needs in Northumberland County. And you can see and the reason why those were unmet needs. So the top one was income support. You can see in the pie chart, the biggest circle color is blue. And most people were ineligible, or there wasn't a resource for their needs. And this is just a picture of over all our Central East region. So, and this is a year old, so we usually do this annually just to give a sense of, on the right are all the various region in the Central East. And you can see the various number, and obviously the higher populations have a higher call rate. And then across our region, the total unmet needs, so health and housing and income are the top three consistently across the region. And then provincially, last year, we handled 270,000 contacts. So in a population the size of Ontario, we're still really unknown. And so we really appreciate the work of United Way in promoting what we do across the region. Provincially, 211's involved with many partnerships. Our system answers many different phone lines, Good to Talk. We answer the Ontario Caregiver Helpline, a number of things where we have a lot of provincial partnerships. But we also work with 211 Ontario to do those things Sarah mentioned, is to really do some custom work or localized programs depending on the community. And our organization's involved in over 100 of these across the Central East region. Most of them are related to healthcare, social determinants of health, just because you know, poverty and housing issues really impact people in many, many ways. Emergency management and homeless services are next to, and it's just depending on the community, the type of relationship we're involved in. But we really try to adapt what we're doing to meet the needs of each local region. From a social determinants perspective, 211 is really in the red area, all the things in your life from, you know, your social safety net, employment, your housing, all those things are really what are related to 211 and the kind of connections our staff are skilled to connect you to. A couple examples of what we're doing in simplifying access to mental health. In Simcoe, Muskoka, we do an online directory and are advertised to call 211 or they use this call or click. So this is just another example of how a community has identified a way for us to help them promote the access to mental health and addiction services. We support our local mental health response unit and helping them connect to motel voucher programs and shelter services when they're out on calls. And we've worked with a group in Nipissing and Parry Sound and Muskoka to launch a 24/7 child and youth crisis line. So we're really, through our work, we're just the answering service and connect those callers to the most appropriate level of service. So that's been a very great partnership for us to be involved in. Another example is reducing repeat calls to 911. We do paramedic closed loop referrals, and I'll speak to that a little bit in a sec. In Simcoe and Grey County, where paramedics are when they go out on a 911 call or doing home visits through various programs that they're working on, they may identify a person that's struggling with food resources or need income. This is an actual referral on the right. It's kind of hard to read, but it was related to mobility issues, but they've checked off food and clothing and personal household needs. So we get that referral in by fax, and then we make an outbound call to that patient and connect them to other services. Report this back. This is a really detailed sample report we give back to Simcoe County on each referral and what actually happened. We're getting about 25 referrals each week from Simcoe and Grey paramedics, and we're able to connect about 50% of those patients to additional services. In the County of Simcoe's program, they were able to do a study on 559 referrals for patients that were referred by 911 to only 211, to no other services. And that cohort showed that there was a reduction of 28% in those patients calling 911. So really good outcomes there. But we're learning as we go with all these kinds of partnerships. And then lastly, just the work we're doing around people impacted by social determinants of health. So it started a number of years ago with a physician in Collingwood, and just helping patients connect with community support services that were funded by the Ministry of Health. So we just create a little referral form with consent from the patient, and then that gets faxed into our system. And what's different about these closed loop referrals are in the blue, and where we're doing, we already know these patients are identified as being vulnerable. So we do a more deeper income and social isolation screening. We'll do 3-minute empowerment, like those stage of change, because for a lot of vulnerable folks, they're dealing with so many things. It's hard to move forward on 3 or 4 things at the same time. We'll do a lot more advocacy and case conferencing and connecting people directly with service providers when needed. All of these referrals are offered follow-up, and then when we do a follow-up, the outcome report is faxed back to the referring source. So they see what happened from our intervention in that follow-up process. These outcome reports are called, that's the closing the loop piece. Did the patient connect? What other needs were identified? How did those services work? Were other referrals needed? And what barriers were identified? So that information really helps the care provider to kind of reinforce things, or maybe offer other suggestions for the patient. This is just a quick sample. It's not really related to numbers, but to show the types of referrals we're getting from the healthcare, transportation, personal and household needs, food, social isolation. So very appropriate referrals for what our work is. And then we can also report back on what happened after the follow-up, and did we identify other services and what other things needed, a week later when we connected with the patient. And we report that all back to the clinician. And then these outcome reports also provide the family health teams with kind of like a community demographics, an overview of unmet needs in their community and the prevalence of needs, and that so they can move forward with some planning. So those are just a couple examples of what we're doing, and I'll just stop, and these slides are going to kind of really just show you the kinds of calls we get and the work we do. And I'll just end by saying at 211, we're really the connector, and we really don't do any of the work. It's your organizations in the community that provide the right services. And our job is really just to connect people to you. And we hope to have more awareness so we can connect more people to get help from all of you.
Thank you so much for that presentation, Pam. Very informative, and for me reaffirms how important 211 is in helping people find the services and programs that they need in the community. And it is really for everybody. Any questions for Pam?
I have a question.
Christine, hi.
Hi, great presentation. This will be a fabulous service for our communities. I have a question about that database. That always kind of excites me. And I wonder if or how you would collect data, demographic data on marginalized subcommunities, for example, racialized Canadians or folks from the LGBTQI communities.
Good question. So again, it would only be on the people that contacted us that we could collect that data. We're just moving forward right now on a national level to add the appropriate elements into our tracking tools to collect the data in the most appropriate way. And our staff are all being trained on how to do that. So we recognize that's a really important element in our data collection. We're just not quite there yet to do that, but we will be for sure. So
that's great. Maybe we should talk later. I'm on a board that might be helpful.
Terrific. Thank you very much, Christine.
We've got another question here in the chat. Are the closed loop referrals currently available in Northumberland with paramedics / family health teams?
No, not right now. We've had a number of conversations, and I think COVID has really disrupted a lot of the path for those kinds of things to happen. I know Sarah's connected us with a number of people. We've been doing a lot of work also in Peterborough County, but not actually implementing the program yet. So.
And if I'll just add to that, thank you, Pam. I think that it's a fabulous opportunity. We certainly are looking to expand it and how we could use it in our county. But as Pam has said, I think COVID has delayed us. That doesn't mean to say we won't be going forward. I think closed loop has a lot of other uses that we would be interested with as well. And I think that with our new community safety and wellbeing plan, which of course is something we're mandated to have across the county, the opportunity there to look at closed loop and further extension and other projects with 211 is a great opportunity. We already work with 211, for example, with our QR code to access excuse me, food information around food security, and people seem to really like that. So that's something that we might look at. We've been talking with Pam very little bit about, you know, how we can develop apps that are more usable and friendly with this type of work. So I think there's far more to come with Northumberland with some of the things that we have begun discussions on. Paramedics is a really obvious one. So yeah, more news to come.
Any other questions? Okay. So just to wrap up, United Ways across Canada have been working to raise awareness about 211 and work with municipalities and government to adopt 211 and to really help raise awareness about the program. Because we know it is so important. We know that it connects people to services that they might not otherwise have access to. So we've got some very interesting and exciting news. The services are now available across Canada. This has come as a result of a lot of the work that has been done at the United Way, Centre Canada national level and the federal government. And a lot of it as well in response to COVID-19. So one of the more of the COVID-19 pandemic has been this urgency to not only recognize the increased use of 211, the importance moving forward for our communities. So very exciting. I won't wrap up just yet because I see that there's another question. So I want to make sure I get to that one. The question is, I'm curious about how the mental health help resources are categorized.
Okay, so 211, United States and Canada all use a taxonomy of just like a library tool to standardize how categories are applied to each service record. It has multiple levels, so you can roll those levels up to like food, or I'll use food for example because I don't do the actual work, so I have to simplify it. And then deeper it would be into like a food pantry or a food box and the things like that. So mental health services would be categorized in the same way. If you go to 211 Ontario or 211.ca and find our 211 Ontario site, you'll see what those the search categories, there'll be subject categories there. We are able, and that's where the custom work comes in on all those directories, is the common point I showed you around mental health and addictions. That group had specific categories they wanted us to use on service records. And so we created custom categories for a specific online directory, which is a little bit different than our general 211 one. Hope that helps.
Any other questions? Okay, well, a reminder that this is being recorded, so we will be able to share it more broadly. We've had a great turnout today, great audience for this presentation. And moving forward, we will be able to spread the message, and we encourage you all to do the same. Thank you so much for attending. Thanks, Pam. Thanks, Sarah. I hope everyone has a great day and you stay safe. Bye, everybody.